Hello to everyone out there. What is rehabilitation? Rehabilitation, I like defining as redefining hope. If in other cases of disease, we can define either sick or healthy or getting better or not getting better, when we come to speak about rehabilitation, it's much more complex than that. Because after a man or a woman is unfortunately wounded, whether in a car accident or from disease or in a terrorist attack like we're experiencing today, then they might not necessarily go back to the life they knew before. They might not necessarily be as healthy as they were before, but then our object is to redefine what hope is for them. What is their new way of health and living? This is a very unique field of medicine because more than any other field, it's a very multidisciplinary approach which we bring to our patients. We're not only talking about physicians and nurses, we're talking about physiotherapists, occupational therapists, speech therapists, dietitians, and of course, psychologists, psychiatrists, and social workers, because we do not differentiate between the health of the mind, of the body, generally, but specifically when we're talking about rehabilitation. So why are we here today? We're here today because Hadassah has the only rehabilitation department in Jerusalem, serving a population of over 1.2 million people in the capital of Israel. And we're so proud that we're now going to complete the new Gandul Rehabilitation Center, where we're going to be able to quadruple the amount of patients, the number of people whom we'll be able to treat. If in routine times, before this terrible war broke out, we knew that the state of Israel, and specifically the city of Jerusalem, was in desperate need of more rehabilitation beds and outpatient services for rehabilitation, then now more than ever, we owe this to the people of Israel, and specifically to the wounded soldiers, civilians, and policemen and women whom Hadassah owes it to them to help them become healthy again and redefine hope for them. Clinical environment is a specifically important part of rehabilitation because it's not only the caring hands and hearts of our staff, it's also the surroundings and the beautiful building that the patients will be able to be in our new center. I'm very excited and proud to introduce Dr. Shir Shabat Ben-Yehuda. Shir is a senior resident and she excels everything she does in rehabilitation. Both her parents are close friends, Professor Arya and Professor Dina Ben-Yehuda. Professor Arya Ben-Yehuda is head of internal medicine at Hadassah, and Professor Dina Ben-Yehuda is head of hematology, and she just finished servicing as her service as dean of the medical school of Hadassah and Hebrew Hughes Medical School. So, Shir, thank you for joining us. I know Shir, but we've prepared to speak this evening and share with you her special experience in our department. So, Shir, please share with us, please, why you chose to begin with to specialize in the field of rehabilitation.
Okay, so I'm really speaking from the heart. Everyone prepared themselves so well. So I'm sorry if I'm a little bit excited. So I chose rehabilitation because I think it's a place where body meets soul, like you said before that. And it's a place where the patient is prioritized, where I can treat him as part of a very big team, a multidisciplinary team. And this team is treating not only the body, the injured organ, but the whole person. And it's a very it's a very great profession because we can get the patients back to their lives, not only to fix their heart or their leg or hand, but to come back to their homes and back to their work and family. And that's why I like it so much.
Thank you. So I think it's totally understandable, you being emotional generally and specifically now. Maybe share with all of us all your connections in this special time. And it's not only your professional connection as a rehab physician, it's also your personal connection as a family member So please share that with us. Thanks.
Okay, so maybe I'll start from the beginning, and I'll say that in the morning of October 7th, I was with my husband and kids in the north. We were in a vacation of all of the commanders of his division, the Gaza division. And in the very beginning of this war, he got a call. All of the commanders that were together in this vacation got the same call that there is a war and they need to come and enlist all of their soldiers and come straight ahead to the south. So we rushed everything. We packed everything right then and drove very fast to the south. During the drive, he got a lot of phone calls, some of them from other commanders, but one of them was from his soldier that was whispering in the phone and telling him that he's hiding in the bushes and waiting for someone to save him after he was part of the party in Re'im. And they were attacked by terrorists. And later that day, my husband did this exact thing. He got to the south and started fighting with his company. And as a commander of this company, he dealt with a lot, from fighting terrorists face to face to evacuating bodies, sometimes under fire. And the last 2 days even got inside Gaza with his company. So this is my husband. I'm very proud of him, but I'm very worried about him. My sister, my own sister, she is so brave. She's the commander of the Caracal battalion. This is a combination of men and women in the same battalion that are fighting together. And she also fought face to face with terrorists during this war. My cousin died at the very morning of the October 7th. He was a soldier in Golani, and he died in Nahal Oz. It was his last Shabat in his serve in the army. He was supposed to be released after 2 days, and he was very, very brave. He fought and treated his soldiers, and at the end, he was so wounded he couldn't stand. But I think it's very hard, and we are very worried all the time, and we're not sleeping a lot at night during the night. But I think we have a lot of resilience, and not only me, but the kibbutz I'm living in and my family. We have to keep our heads straight, to be there for our kids, to be there for our patients. So during the night shifts, when I'm treating patients that were there and fought there, sometimes they were just civilians that were slaughtered, or saw their families slaughtered or bombed. And they are sharing their pain, their stories, their physical pain, their emotional pain. And sometimes I'm thinking during this time of my family, but I'm keeping my professional duty, and I have the right. It's a very great right to treat the wounded and the injured. So this is where we are. I think we have a lot of resilience. My grandmother, that she's not with us. I think maybe it's a good thing. She doesn't have to be now to see everything that's happening, but she always said she was a Holocaust survivor, and she always said that people will always try to hunt us and to break us, but we will never break. We will always survive. So I believe that.
So you're saying that actually treating the wounded civilians and soldiers actually gives you strength in these difficult times, and that you feel that it's a privilege. Why do you think? Do you feel that the new center that hopefully will be able to open in the near future, do you feel that that might have a more significant impact on your capability to help your patients?
I'm very sure of that. I want to thank everyone that's here that wants to listen and to hear us. And I'm very sure that the patients that are coming every day more and more, they will need a healing environment. And the healing environment is exactly what you said earlier. It's a place where there are also surroundings. It's not in a very closed building. It's not in an old building where they sleep sometimes 5 and 6 patients in the same room. And they need windows. They need to see more people like them, but in a very healing environment. It's very important in the rehabilitation process. We believe it very much, and we need to promote it as soon as possible.
Shir, thank you for everything you do, specifically for this discussion. And I really send a lot of strength and love to all of your family out there.
Thank you. Thank you very much.